Hello everyone, I'm Jean Paul. Today I'm going to talk you about the anatomy of the internal organs. We're going to start with the lungs. We'll talk about the anatomy, irrigation, nerves, location. The lungs are in the thoracic cavity on each side of the mediastinum, inside of the pleural cavities, right there. We have pleura, which divides into visceral pleura and parietal pleura. Visceral tightly adherent to the lung surface inter the fissures, and parietal pleura lines the inner thoracic wall, diaphragm and mediastinum, right there. Mm, in the right lung, we have three lobes, superior, middle, and inferior, two fissures, oblique and horizontal. And the left lung, we have two lobes, superior and inferior, and one fissure, oblique. Has a lingula right there. It's kinda or like a tongue projection of the superior lobe. And we have bronchopulmonary segments. Each lobe is divided into bronchopulmonary segments, which are primary shaped lungs. It's just on cemetery branch of the pulmonary artery, and clinically important because they can be surgical research individually. I'm going to talk you about the irrigation of the lungs or blood supply of the lungs. There are two distinct circulation: functional circulation or pulmonary trunks. Right and left pulmonary arteries arise from the right ventricle right there and carry the deoxygenatory blood from the lungs to the left atrium right there. And we have nutritional bronchial circulation, which provide to the bronchial artery, usually branch from the descending thoracic aorta right there, and sometimes from the posterior intercostal artery of the subclavian branch, supply the bronchial walls, connective tissue of the lungs, and visceral pleura, respectively. And the innervation, which right there. Parasympathetic, sympathetic, and visceral afferents. In parasympathetic is the vagus nerve, cranial nerve 10, which have the fusion of vasoconstriction, vasodilation of the pulmonary vessel, increase the mucus secretion in the airway. The sympathetic from the upper thoracic to the T2 and T5 respectively. Bronchodilation, vasoconstriction of the pulmonary vessels, decrease of the glandular secretions, and the visceral afferent reflex fibers for cough on strength, pain of for lungs tissue, its location, pleural plane, the parietal pleura right there. It's combined by intercostal and phrenic nerves, and each more localized nerve. Phrenic nerves, it's kind of like there, and that's all. I'm going to talk you about the heart anatomy. Situation in the middle mediastinum, which have a base posterior and part mainly of the left atrium, and have the apex right there. Which have right atrium, right ventricle, left atrium, and left ventricle, which have major bulbs, atrioventricular bulbs, tricuspid, right ventricular, mitral and bicuspid, semilunar bulbs, pulmonary artery, aortic bulb, which have a coronary blood supply. The heart is supplied to the right and left coronary arteries. I went to runs in the right atrioventricular coronary sulcus, main branches right the marginal artery along the right border of the heart, or posterior interventricular, posterior descending to the PDA right there. In most people have a right dominance and supplied it's the right atrium, most of right of ventricle, posterior part of the ventricle septum, often the CA node and atrioventricular node. And his innervation is sympathetic T1 till T5, preganglionary fiber from the upper thoracic segments, cervical and upper thoracic sympathetic segments, and postganglionalic cardiac nerves, which affects increase the rate of the heart, positive chronotropy, increase the chronotactile positive inotropy, increase the conduction velocity, positive dromotropy, and coronary arteries for the vasodilatation to have a metabolic control also improve. And parasympathetic, which have the vagus nerve, cranial nerve 10, which decrease the heart rate, atrial contractility, and atrioventricular conduction velocity. And now I'm going to talk you about the liver and the pancreas. Liver is located in the right upper quadrant, extending from the epigastric region, covered by a thin fibrous capsule. Having innervation on this station is going to like to reflect the pain. Anatomic lobes, we have the right lobe, left lobe, caudate lobe right there, and quadrate lobe. Functional segments, it's divided into 8 functional segments, each with its own portal rank, which have portal vein, hepatic artery, bile duct, its own hepatic venous drainage. It's important for segmental left resection. And his blood supply of the liver, we have portal vein, hepatic artery proper, and his venous range from both to the synovial in the central veins, hepatic veins, right, middle, and left, and which have entrance to the inferior vein cava. And his innervation is by the hepatic plexus, which have a station of the celiac plexus, and part of the vagus nerve. And I'm going to tell you about the pancreas. We have the retinary gland from the bad exocrine, which secretes digestive enzymes, and endocrine, which kind of insulin, glucagon, etc. Left transverse across the posterior abdominal wall, which have a purse, it's kind of head, onychates proxexure, look like a hook, neck right there, body, and the tail, which the ileum of the spleen, and the sporulina ligament. The blood supply of the pancreas is supplied the pancreoduodenal arcades from by superior pancreaticoduodenal artery, inferior pancreoduodenal artery, and the neck, body, and tail supply the pancreatic branch from the splenic artery. And his innervation, its sympathetic fibers T5 to T9 with the celiac ganglia, mesenteric plexus, and from the vagus nerve in the parasympathetic. In pain refer to the epigastrium and radicate to the back, especially when it's kind of pancreatitis. Now I'm going to tell you about the gastrointestinal tract with emphasis anatomy of blood supply and innervation by region. So, we have the foregut, distal esophagus, is composed of distal esophagus, stomach, proximal duodenum, liver, biliary system, pancreas, and the spleen. And it have a general irrigation by the celiac trunk and have a parasympathetic innervation cause the vagus nerve. In the midgut, we have distal duodenum, jejunum, ileum, cesium, appendix, ascending colon, and proximal um, diffraction of the transverse colon. And his main artery is the superior mesenteric artery, and his parasympathetic is the vagus nerve, and the hindgut right there. We have the distal first of the third parts of the transverse of the colon, descending colon, sigmoid colon, rectum, and the you can see it right there, and the upper anal canal, which hide the main artery, inferior mesenteric artery, and the parasympathetic innervation correspond to the pelvis splenic nerves. Is 2, 2 is 4. We have the abdominal cement, the distal esophagus right there. We have blood supply, arterial and venous. Arterial, each correspond to the esophageal branch from the left gastric artery, from the celiac trunk, and sometimes branches from the left inferior phrenic artery. And the venous, we have the left gastric vein to connect the blood to the portal vein, to the esophageal drains in the azygos system, portal systemic anastomosis. It corresponds to varices. And cis innervation correspond to the esophageal plexus from the vagal trunk and sympathetic fibers from the thoracic simple trunk via splenic nerves. The stomach, we have the cardias, fundus, body, antrium, and pylorus right there, which have curvatures, the greater curvature and the greater curvature and less curvature, which have a blood supply. It's correspond the left gastric artery, right gastric artery, usually from the hepatic artery proper, along the greater curvature, the right gastroepiploic or gastromental from the gastroduodenal artery, left gastroepiploic artery from the splenic artery. We have the fundus, short gastric arteries from the spleen artery. In his venous drainage, like in the Meros artery. All the drain to the portal system via left gastric, splenic, or superior mesenteric vein. And the sympathetic innervation correspond to the vagus nerves, and sympathetic from the T6 to T9 via greater splenic nerves. It's kinda connect to the celiac ganglia and ability, motility, and constrict blood from vessels. Small intestine, duodenum. Me falta eso. You can see it right there to the duodenum, jejunum, and ileum. And his blood supply, the jejunal and ileal branch from the superior mesenteric artery, from the arterial archites in the mesentery, give of the straight artery, vasa recta to the wall, and his innervation is correspond to the parasympathetic vagus nerve, increase the motility and secretion, and sympathetic, which have from the T8 to T12 via superior mesenteric plexus decreases the motility and vasoconstriction. We have the large intestine, we come section appendix, and his blood supply correspond to the ileocolic artery and appendivesicular artery branch from the ileocolic supplies of appendix. We have the ascending colon right there. It's irrigated from the right colic artery, mild colic artery, and forget it. And the distal and transversal column and descending column and signal column supplied from the inferior mesenteric artery, left colic artery, and sigmoid artery, and directed on the anal canal, which kind the superior rectal artery and medial rectal artery from the internal iliac, inferior rectal artery from the internal pudendum. And his innervation correspond from the left colic flexure in the midgut part, parasympathetic vagus nerve, and sympathetic via superior mesenteric plexus, and the distal to the left colic flexure hinge part, which hide the parasympathetic pelvic splenic nerves, is due to is for via inferior hypogastric plexus, and sympathetic which hide the via lumbar splenic nerves and hypogastrical plexus. Il1 to Il2 approximately.